I'm Dr. Doris Day. I'm a board-certified dermatologist attending at Lenox Hill and clinical assistant professor of dermatology at the NYU Langone Medical Center. I've been a dermatologist for about 15 years, and my experience has taught me that great skincare can also be very accessible. My philosophy of skincare is helping patients understand how important general skincare is in helping them not only look their best and feel their best, but it's important for their general health as well. One of the most important conditions I treat is a chronic condition called eczema. Eczema is a skin disorder that affects nearly 5 million people and often occurs in infancy. Actually, up to 85% occur by the age of 5. The most common form of eczema is atopic dermatitis, a problem of the skin's immune system. Common eczema symptoms include itching, scratching, even to the point where the skin can bleed. Eczema in children can be apparent on the cheeks and in the joints, and it can be very uncomfortable, leading the child to not sleep well at night and have them be more irritable during the day. Over time, it may extend to other parts of the body as well, and in early infancy, it can be something called seborrheic dermatitis, which we know better as cradle cap. Often children can't help but scratch, and once they have marks in the skin, that can affect them socially as well. When they're out with their friends, they may be ridiculed and they may withdraw socially. Fortunately, many of these children outgrow their eczema by the age of 2, but it can become a chronic condition, so it's important to manage it over time. Many factors can contribute to eczema, including impairments to the skin's natural moisture barrier. Research has identified a specific protein called filagrins that may be defective in patients with eczema. Filagrins are proteins. You can think of them as the glue that holds the skin cells together. When they're not intact and functioning properly, excess water leaks out of the skin and can leave the skin very dry and itchy. Important tips to help manage the symptoms of eczema and to minimize them include, first of all, avoiding the irritants, things such as dander, pollen, dust mites, anything that you might be allergic to or irritating to the skin. It's also important to avoid irritating clothing. For some people, this can mean almost anything besides cotton touching their skin. It's important to have a diet that's healthy in omega-3s. This includes foods such as almonds, walnuts, and freshwater fish such as salmon. Looking for colorful fruits and vegetables that might be high in vitamins A and E is also really helpful. Stress is not a direct cause of eczema, but can certainly make it worse. Avoiding contrast in temperature, so going from very hot to very cold, can be a stress on the skin, and that can make eczema flare in some people as well. Also, proper moisturizing of the skin really helps minimize a lot of the symptoms of eczema. I realize that sounds like a lot to remember, but many of these tips can be incorporated into your general skincare routine and are great for general health as well. Using the appropriate products is really important for managing this condition. Cetaphil Restoraderm Skin Restoring Moisturizer, a light, non-greasy product, can really help hydrate the skin. It has a combination of filagrin and ceramide products that help avoid excess water loss. Cetaphil Restoraderm Skin Restoring Body Wash cleanses the skin but doesn't remove the skin's natural oils and helps minimize excess water loss, one of the main problems in eczema. Both products have been awarded the National Eczema Association Seal of Acceptance, and these products are available at your local drugstore. I treat eczema every day, and I know it can be very difficult to have a chronic condition that requires daily care. So having products that help manage the condition and minimize the symptoms is very rewarding for me and my patients. For more information about eczema and the Cetaphil products, you can visit Cetaphil.com.